Well, I want to welcome you all back. This is the very first live Café Scientifique since before COVID, believe it or not. I'd just like to say on behalf of the organisers, Ness and Kevin are at the back there. They are intending on starting this up again from September on a monthly basis, you'll be pleased to hear. So that'll be super to get this back and running again. So this event's very special, and it's a welcome from myself, Café Sci, but also from the World Congress of Basic and Clinical Pharmacology and the British Pharmacological Society. And we're running this as a sort of adjunct public engagement event alongside a big congress that's going on at the SEC, all about pharmacology and drugs. And David's actually given 2 talks today already, so he's warmed up. So who's new to Café Scientifique? Okay, so just a very quick explanation of what's going to happen tonight. So David's going to talk to you about his science and his book in broad terms, because the main part of this evening is going to be your discussion with David. So he'll talk for 20 minutes, half an hour, and then we'll invite questions from everybody in the audience. And then after 20 minutes, half an hour, we'll have a little bar break where you can think of more questions. And then we'll come back and have another question and answer session. So really this is all about you, the audience, to ask questions of the scientists. That's what these Café Scis are designed to do. And they work very well, we think. There's going to be book signing at the intermission. If anybody would like to buy David's book, David is happy to sign a copy of his book. And I think that's all I've really got to say, except to now introduce David officially, who is well known to all of you. Some of you have come very far to hear this talk this evening. Some people from the north of England. We've got people from the borders. We've got people from Edinburgh. So welcome, everybody.
Anyone from Orkney?
There you go.
Norwegians?
And it's so nice to see some very familiar faces from Café Sci of old. It's great to see you all back. So David is a psychiatrist and a professor at Imperial College. You've all seen his biog online, so I'm not going to go through it. It's very, very extensive. But he's currently founding chair of the charity drugscience.org, president and has been president of the European Brain Council, the British Association for Psychopharmacology, and the British Neuroscience Association, and many, many other things. So I'm not going to waste any more of your time. I'm going to hand you over to David. So thank you, David.
Thank you very much. Well, it is great to be here for many, many reasons. It's a long time since I've done a Café Scientifique also. But it's also nice to be at a major conference at this wonderful conference centre that you have here. I think the last time I came, there was just the one building, the Armadillo. Now you've got a big round building, I think called something to do with Hydro. Is that a swimming pool, is it? and then you've got another big building, which is the conference centre. It's actually really impressive how you've expanded. So it's obviously put Glasgow on the map in terms of international science conferences, having that much space. But I'm particularly grateful that there are people in the town of Glasgow and beyond who wanted to come and talk to me tonight. And it's extremely timely because for 2 reasons. One is that it just happens to be less than a week since the book was actually released. And I'm actually amazed. There are people who have come with copies already. You must have better mail up here than I have down in Bristol. And it's also very timely because on Saturday, something really interesting happened on Saturday. Do any of you know what that was? Go on, tell them.
Australia made medicines.
That's right. The Australian regulators, in Britain we have a regulatory organisation called the MHRA, Medicines Healthcare Regulatory Authority. In Australia they call it the Therapeutic Goods Administration, the TGA. And on Saturday morning, before we woke up, Australia had now made psilocybin, magic mushroom juice, a legal medicine for people with treatment-resistant depression, and MDMA, which is the active ingredient in ecstasy, a licensed treatment for treatment-resistant PTSD. And that is absolutely groundbreaking because Louder?
Louder if you could do that.
Yes, please.
Louder. Is that better?
Is that better?
Is that better? Is that loud enough? Sorry. Okay, cool. Don't leave. And that's actually had a huge impact on my life, because I spent the last 2 days doing radio interviews and tweets and conversations with newspapers and that about that. And I hope it's the beginning of a change. It'll eventually roll out over the UK. One of the reasons I'm quite keen to talk to people in Scotland is that, you know, as you probably know, you have a devolved healthcare system here. And I think I'd be very interested if you could persuade your health minister do the same as the Australians did. And I'm going to meet some of your politicians on the 28th of September. I'm up again for a conference in Edinburgh, and we're going to have a meeting in the Scottish Parliament, because it does seem to me bizarre that in the UK, which pioneered the research with these drugs, as I'll tell you about in a minute, should be actually really lagging behind other countries. Because it's not just Australia that's actually made a significant change, but also many of the US states are beginning to move towards either decriminalisation or legalisation of magic mushrooms. And it's quite likely that MDMA will be a licensed medicine in America by the end of next year for PTSD. So the world is moving on. We're lagging behind, but you guys could go it alone. And if you want to campaign for that, I'm very happy to give you all the supporting evidence. I'll even sign the book for you, so you can give it to the politicians to know it's worth having. Because one of the things that we have discovered is that not only are these treatments, particularly psilocybin, effective for depression that hasn't responded to other treatments, but they're also remarkably effective for addiction. And as you all know, that is a bit of a problem here. You know, you have the highest rates of alcohol cirrhosis in the world. You don't have the highest death rates from alcohol in the world. Russia well beats you on that. But you do have a lot of problems with alcohol, and of course you have a lot of problems with opiates. And you have, I think, very near to here. He's not here, is he? Is Peter Crikant here? You don't have the van. The van man's not here. The man with the injection van, no? Oh, okay, so you set up the first safe injection facility in the United Kingdom, and he's managed to run it here out of his van, which I think he parks around the corner here. So, you know, you have made serious progress in terms of harm reduction in relation to addiction. But psychedelics can dramatically change people's affinity for the drugs. And a lot of people don't know that. And one of the best kept secrets in the history of addiction is the founding of Alcoholics Anonymous. So you've all heard of Alcoholics Anonymous. Most of you probably don't know who founded it, a man called Bill Wilson. Some of you might. And what almost no one knows, because it's been repressed, is that Bill Wilson, when he was 33, he'd been an alcoholic since he was 17, and they were about to lock him up in a home for incurable inebriates. And he had a powerful psychedelic trip using they were treating him with a medicine called the belladonna cure, which is a scopolamine-based treatment, which some people use these days to produce psychedelic experiences. And he had a really profound experience, which I document in the book. And he suddenly discovered he didn't care about alcohol anymore. He described being freed from the shackles of his alcohol dependence, because he had this powerful spiritual experience in the trip, which is what a lot of people with depression as well as addiction do. And as a result of that, he said, I want to establish myself in sobriety, and I want to facilitate it for other people. So he set up Alcoholics Anonymous, which became a worldwide phenomenon. Millions of people going there, millions of people benefiting. And that was in 1933. And then in 1952, when LSD became available in the States and in Canada, Bill Wilson took LSD, and he had this amazing insight that actually LSD could do for other people with alcohol problems what the belladonna had done for him. It could actually allow them to see there was something more to life than booze. And he campaigned in the 50s and 60s and was very successful, because he was one of the most influential people in the world, certainly in America, and he persuaded the US government to fund 6 trials of LSD for alcoholism. And they were very straightforward. Basically, they just took people who were going through the AA program and they just gave them 1 or 2 doses of LSD, and they found the outcomes were massively better than they were getting without the LSD. In fact, 10 years ago, 2 Norwegians went back and they got hold of the source data of those 6 trials, and they put them through what we call a meta-analysis. They took all the raw data and they did proper modern statistics, and they showed that the impact of LSD and alcoholism, just 1 or 2 doses, was 3 times bigger than the best treatments we have today. The problem was that in 1967, a man called Richard Nixon was trying to get elected. And Richard Nixon was in favor of the war in Vietnam, but most Americans weren't. And he was doing very badly in the polls. And so he had to come up with a ploy to distract people from his desire, which was to bomb Laos and Cambodia into pulp, and deflect people to something nearer to home. So he was advised by his SPAD, John Ehrlichman, that the way forward was to attack hippies and black people. And as Ehrlichman said, we couldn't make it illegal to be a hippie or black. I mean, they probably thought about it. But what we could do is we could vilify hippies with marijuana, using marijuana and psychedelics, and we could vilify blacks for using heroin. And then we could attack them remorselessly on the news every day, and we could break up their meetings and arrest them and just generally create hysteria about drugs. So they created a war on drugs and drug takers to deflect attention from the war in Vietnam. And that was very successful. Nixon got elected, he won every state except Maine, and then he carried on waging the war on drugs. And because the US was so influential, because it ran the United Nations, it ran the WHO, the American policy was rolled out around the world. And in 1971, we conceded to the American policy, and we banned these drugs because the Americans told us to. And you think about it, that's what, 50, 53, 54 years ago now. I reckon 100 million, a minimum of 100 million people worldwide have died of alcoholism. And you think, well, suppose LSD had helped 10%. It probably would have done better, but say 10%. You know, that's 10 million lives saved. And how many lives have been saved by banning LSD? Well, probably none. But maybe it deterred a few people, maybe 100, maybe 1,000. I'd say 1 million, I don't care what you say. Because the reality is the equation is so utterly in favour of using it as a treatment than banning it. And the banning was remarkable. It was the only time in history that a drug and a drug class have been banned because they changed the way people voted. Psychedelics were encouraging people to think differently about war. The Americans wanted to continue their international policy of waging war. Most other countries did too, and so they all fell in line with the American approach. And my view is that censorship of research with psychedelics is the worst censorship of research and clinical therapy in the absolute history of the world. There is no other example of censorship that gets remotely to that same level of damage and harm. So I've just given you one example with drinking, but the same would apply to suicide and to depression, etc. The best I can do in terms of thinking of a comparable example is actually, you've got to go back a long way. You've got to go back to 1642, which I guess, as most of you remember, that was when the Catholic Church banned the writings of Copernicus, because Copernicus had worked out that the Earth was not the centre of the universe, the sun was, and they didn't like that. So for 150 years they banned the teachings of Copernicus, and that was pretty effective, you know, because they took people like Giordano Bruno and they burnt him at the stake for actually saying that there was something called the universe out there, but it only worked. It only was effective in Catholic countries. So as you almost certainly know, the Scots were able to keep looking at the heavens with impunity, as were the Danes and the Norwegians. So it is only limited to the Catholic astronomers, and there weren't actually that many astronomers, a few hundred, whereas there are hundreds of thousands of neuroscientists, hundreds of thousands of psychiatrists and psychotherapists who've been denied access to these drugs. I presume that isn't a commentary on my presentation, that noise, is it? Is it something we should be worried about? No, it's just the car, is it? Okay.
Everybody here at the back, so you're all right.
So why have I written this book? Well, how many of you read my book called Drink? No, it's never been popular up here. How many of you read my book called Cannabis? Thank you. What do you think of it? So, this is the third in the series. This is the end of the trilogy. And all three books were written to give intelligent people like you, who actually want to come and learn things and think and talk, an opportunity to read something which really just tries to lay out the facts without prejudice, without opinion, without morality, without politics. And that's what this book does. And as I've said already, the banning of psychedelics is the worst censorship in the history of the world. Well, you might reflect on it. I mean, how many people each year die in Scotland of opiate death? I mean, it's several thousand. Well, probably 1,400 or so. Anyway, it's quite a lot. And that's been happening for decades. Why didn't they ban opiates in 1971 when they banned psychedelics? Because the Americans were actually supposedly concerned about blacks using heroin. The reason they didn't do that was because they accepted they had a medical value. But they denied the medical value of psychedelics. They actively denied it, and they hoped by putting these drugs into what we call Schedule 1 of the UN conventions and Schedule 1 of the UK conventions, they hoped that people would forget about them. There was actually a genuine desire to eliminate all knowledge. People would never know about psychedelics. It's kind of weird, really, because when we look at the history of humanity, it's actually quite difficult to find human existence that isn't coincidental with psychedelics. There is a theory that some of the great cave paintings that go back 20,000 or 1,000 years ago might be psychedelically induced, which is plausible. But one thing for certain, both in North Africa and in Latin America, you see amazing carvings of mushroom men. And there's no question whatsoever that people were using mushrooms to get visions at least 12,000 or maybe 20,000 years ago. So psychedelics have been with humans all our existence. And one of the most exciting theories that I've come across is the theory that the ancient Greeks, well, it's not a theory, it's a fact, that but the theory is that psychedelics fueled the vast expansion of intellectual innovation and growth that occurred in ancient Greece. And the way that happened was that the ancient Greeks realized that come September, late September, the cereal crops would start sprouting little dark brown protuberances, which we now know are the ergot fungus. The Greeks didn't know that. The Greeks thought this was actually really what the cereals were about. They thought this was a final culmination of the growth of the cereal crop. And they worked out that if you take the ergot, which contains a weak form of LSD, and you eat it and drink wine, you get into a very interesting state. And, it's replicated very regularly throughout the summer in Ibiza, I believe. And they put aside several weeks of the year when they knew the ergot would be growing on the wheat to have what they called their mysteries, the Eleusinian mysteries. When they left the city-states, they went into the fields, they drank, they chewed ergot, had visions, hallucinations. They performed their dances, their theatre, their music. They probably did a few other Dionysian things as well. And then afterwards, like those of us who've come back from holidays in the sun, they went back to the city-states and they did what the Greeks were generally better known for doing, which is in developing and inventing geometry and logic and reason and also democracy. And you can make a plausible case that it was psychedelics opened the Greek mind to the possibility of the human mind. And as we know, you don't have to look around this city very far to see that the Greek influence. This is a neoclassical city based on our belief that the Greeks actually were probably the most civilized culture there's ever been, and we've tried to mimic them. So maybe psychedelics have actually underpinned everything that we have tried to do in the West. So this book's about the history. It's about the science, about what the different drugs do. You can learn about the different psychedelics. How's ayahuasca different from DMT, from 5-methoxy, from toad skin, etc., etc. But most importantly, you can learn about their therapeutic utility, because what has transformed this field in the last 15 years is research on these drugs using brain imaging techniques, which have shown how they work. So up till the middle of the 2020s, the zeros, we just knew they produced effects, but we didn't know how. Now we can look into the brain of people using these drugs. We can see profound alterations. We understand the nature of the psychedelic state. We also understand the nature of consciousness, or at least we got closer to understanding altered consciousness. And one of the most remarkable findings from those imaging studies is that psychedelics switch off parts of the brain which cause depression and cause addiction. Now, no one could ever have predicted that. I mean, okay, we knew psychedelics could treat addiction from the work of Bill Wilson, and the other people in the 50s and 60s, but we didn't know why. Now we know why. We can look in the brain of someone, and we can actually look in the brain of people who have been healed by psychedelics, and we can measure their brain patterns of brain activity, and we can predict how well they're going to stay over the next 6 months. And that is an utter revolution in terms of science, but it also translates into clinical practice. We now have multiple trials in this country, in America, in Switzerland, in Canada, USA, where we can show that these drugs do, in modern trials, lift disorders like depression and PTSD, which is why they've been made a medicine in Australia. So I think we're on the cusp of a new wave of psychiatric treatment. This is going to revolutionize psychiatry. We haven't had any real innovation in psychiatric treatments for 50 years. The drugs we use today, that many of you will be taking, are safer than the old ones, but they're no more effective. These drugs are more effective, and they're remarkable because you only need 1 or 2 doses. You're not taking them every day. So it's a paradigm shift in treatment of...
So I'm saying it's sort of Wendy's budget problems.
There you go. Absolutely. She's a pharmacist. So you can revolution... Yeah, exactly. The individual treatments might not be cheap because you need 2 or 3 therapists, but the benefit in the long term, so you're not on medication forever, could be remarkable. So that's what the book's about. If you want to buy a copy, well, they're ready. I'll be signing them for you afterwards. But I think I'll open it up to discussion now. Is that all right? Whose car is that, by the way? We won't look if you go and turn it off. The microphone is going around, is it?
I'm the microphone.
I'm
afraid we don't have a roving mic tonight, so I'm going to be the microphone, and maybe Kevin, if he's hovering around the back. So I'll come and stand by you. If you've got a question, if your voice isn't loud enough, I will amplify it for you. And one thing I should say to everyone, there's no such thing as a daft question at Café Scientifique. If you have a question that you want to ask, you can be sure that somebody else in the audience probably wants to ask the same question. So just go ahead and ask. So this gentleman here.
Is anything known about the chemical pathways through which psychedelics switch off those parts of the brain?
Yes.
Serotonin involved or other neurotransmitters?
Did everybody hear that at the back?
Great question, yes. Absolutely. So we know an awful lot about this now, and it's turned out to be both traditional and innovative. So the drugs I've talked about, ayahuasca, DMT, LSD, psilocybin, and even an MDMA, which is not a psychedelic, but it's a serotonergic drug, they all target the serotonin system. And the psychedelics stimulate the receptor. The serotonin system is in evolutionary terms a very, very old system. It's the first of the systems of amines that coordinate the way in which mood and affect is controlled in the brain. And because it's been around for so long and it has so many roles in different parts of the brain, there are 15 different serotonin receptors. 15. But there's one specific one called the 5-HT2A receptor that all these drugs target. And what is the reason they work is because those 5-HT2A receptors are massively expressed in the most recently evolved parts of the human brain. So the parts of your brain that came up with that question, we call those the transmodal cortex, the parts of the brain which bring together everything in your brain are loaded with these receptors. No one's entirely sure why, but it is a coincidence that there's this evolutionary development of brain and they've all got these 2A receptors. In fact, one of the papers that I think we've just got accepted, we're putting out a theory that maybe these receptors drove the evolution of the human brain. Maybe they actually made the human brain much bigger, because your brains are way bigger than Neanderthal and also, obviously, chimpanzee brains. And the bits of the brain that have really grown have grown because they've got all these 2A receptors there. But we're not entirely sure why they're there, but one thing's for certain, when you stimulate them, they change the way in which integration occurs in the brain. And what's really clever about it is that they make the brain more flexible, as I mentioned. The way your brain works, your brain is an amazingly efficient, and you may not know this, but each human brain has more computing power than all the computers on Earth today. And that is because your brain it's about 100 billion computers all linked together. And that's a lot. If you think so you've got 100 billion little computers, and they each connect to 1,000 others. So you can work it out. You know, that's 10 trillion computers in your brain, and bringing them all together makes your brain so ridiculously powerful. You can remember insane amounts of knowledge, but you can also create and imagine and analyze. And that process of the integration of the brain is done through those brain regions which have got all these receptors. When you stimulate those receptors, you break down the normal processing. So, for instance, if you're a depressed person, you know, you spend a lot of your time thinking, I'm worthless, I'm useless, I'm hopeless, I'm at fault. Psychedelics just break down that thinking process, and people can suddenly realize, and we see this on our patients, they suddenly see why they're depressed. They see that actually it was people abusing them as children rather than their fault. And they can free themselves from these shackles of self-denigration. So we know that the 2A receptor disrupts cortical integration, allows new ways of thinking, and also facilitates the laying down of new memories and new thoughts, because it actually drives the production of new synapses and new dendrites. Thank you. We call that neuroplasticity, and that's why psychedelics produce usually very, very enduring memories, because they lay down rapidly the new pathways of encoding those memories. Another question?
Have this gentleman and then this lady.
Should psilocybin only be taken under medically controlled conditions? It's a two-part question, and also should it be taken by your average person who doesn't suffer from alcoholism and depression?
Yes, so the question is, should we limit psychedelic use to people who can get them in a controlled situation? And the answer is we would highly recommend that. I mean, psychedelics are relatively low in harm, even if you take them recreationally, but we really don't. If you're going to take a drug as powerful as that, it's best to do it in a situation where you're safe. I mean, there's this I comment in the book about Nick Cave's son. Him and his mate, they decided they want to experience LSD while they were standing on Beachy Head. Now, that is a really dumb thing to do, because, who knows why they fell off. Maybe it was a mistake, maybe they thought they could fly, I don't know. So what we recommend, if you're going to do it, people call it recreation. I don't like the term recreational, because a lot of people take psychedelics because they're interested in to know what the extra capacities they have in their mind. But if you're going to do it in a non-medical setting, make sure there's always one of you that isn't doing it. But what we found, when we give psychedelics to healthy people, in a brain scanner usually, because we're interested in their brains, and even in those weird circumstances, people often come out feeling better and brighter. Even in healthy people, it does seem to add some kind of value to life.
Yes, go ahead.
Yeah, so I'll repeat it. Go on.
Can I do a two-part question? That's two different sort of...
Oh, go on then.
Is there an economic argument by society that wants to maintain the medications that we provide for people right now, as opposed to treatments that you're talking about now? That if this is one or two treatments that will effectively...
Well, that's a very, very good point. I mean,
whereas if you've got existing medications,
that's why
there's a lifetime of prescriptions.
Yeah, that's why drug companies aren't involved, because no major drug company is involved in this research, because they do not know how to make money out of it. And that actually is a serious condemnation of the way we do medicine. If you can only have medicines that American venture capitalists will invest in, then we're stuffed. And that's one of I was quite instrumental in getting the Australian decision. I spent 3 weeks in Australia last November talking to the regulators, talking to their ministers, both at the state level and at the national level, federal level, talking to the senior health authorities. And the clever thing that Australia did was they didn't just make it available, because they could have, doing that wouldn't allow you to get it. I mean, it's all very well to say it's a medicine, but how do you get it? The really clever thing was a charity in Australia called My Medicine Australia is an importer. It's put out a contract to Canada for the manufacture of medical quality psilocybin and MDMA, and it is importing it. It's gone through all the regulations. So it's being made and available by a charity, because companies won't do it. And even the big companies won't. The small companies are failing, because it's going to take to bring a new mental health medicine to the market costs at least £200 million. There's not a single company in this space that's got that much capital. And my suspicion is it won't happen if we rely on the commercial route, because only the really big companies have that money, and if Pfizer and GSK and that aren't going to invest, it's not going to happen. And we have to find another way, because every day in this country about 50 people commit suicide. The majority of them either have trauma or they have depression, and of those, the vast majority of those have been in treatment and it's failed. So every day we wait to get access, we're just condemning 10, 20, 30 people to suicide because they can't access to it.
Have you got another quick question?
Yes, you were talking about the breaking up of the synaptic connections and the brain effectively rejigging itself. Does that work completely independently, or would the treatment be, yes, provide the medication, but also talking therapies?
Yeah, let me explain. Absolutely.
Talking about someone visualising their life without depression, with coping with the traumas that they've had.
Could you perhaps summarise the question, David?
Yeah, so the question is it just a drug, or do you have to do some therapy with it? And we strongly believe that therapy is important. We can't prove that, because to do that, to prove it will be very complicated and difficult and expensive, and who's going to pay anyway. But what we do, and I mean, what is a session? So whether we're talking about MDMA for PTSD or psilocybin for depression, a treatment has three components. It has a preparation session or sessions. So you have to make sure people are safe to have the drug, that they're not on other medications, they're going to mess that up or cause problems. They know what to expect. They can give informed consent. That's preparation. Then there's a treatment day. Now, the treatment days are different for psilocybin and MDMA. For psilocybin, the treatment day is basically a period of 4 to 6 hours where people largely are inside themselves. They have eye shades, they have earphones to play music, and we ask them to just go where it takes them and not to resist it. And usually they go to the traumas or the problems that have led to their depression, but we're there for them. And if they get really frightened or if they want to talk, they can talk. But mostly they don't. Mostly they explore this inner world which they haven't been into forever. With MDMA, it's different. With MDMA, it's not a psychedelic. It allows them to engage with their emotions. So very often in the MDMA sessions, they talk about the trauma. They actually want to talk about the trauma. They want to overcome the trauma. And then the third phase is what we call integration. So the next day they come back and they talk to the therapists about their experiences, and that's particularly relevant with the psilocybin because they haven't talked about it the day before. And then they talk about that, and the therapists help guide them and help make sense of it and help encourage them to think differently. Okay, so you thought it was your fault that your father abused you, but it wasn't his fault, was it? And we had one of the most moving experiences was one of our patients who said during the trip I saw my father abusing me. And he said, I was able, for the first time, to confront him in the trip and tell it. I could see him as a pathetic, despicable old man. And I was able to say to him, that's it. Now, I realise now you're the cause of my problems. And he got closure, and he came out, and he's one of these people that's been well for 10 years. So, yeah, we strongly believe that people get extra benefits from... They need the therapist there anyway to protect them, and talking about it afterwards adds value. Yeah.
I have a question over here.
I think so. Thank you, Professor Nutt, for that information. I was wondering, in your opinion, why it is that we have so many antipsychotics, antidepressants available over a GP table. However, access to such things as MDMA and perhaps off-label drugs are not available. Is this because of the decriminalisation?
Yeah, it is. I mean, I think the bottom line is that I've thought a lot about this, and I've actually spent a lot of time trying to get to the truth. The question is why aren't these medicines essentially? Why we got lots of pharmaceutical medicines, whereas these drugs, which were medicines, aren't medicines. And I touched on it earlier. It was the war on drugs, and I have done a lot of work on this, trying to talk to the people who actually know what the big banning of these drugs started in the 1960s and culminated in the Nixon war on drugs. And I used to think that there might have been some pharmaceutical company lobbying because they wanted to get into this market because antidepressants came along later, anti-anxiolytics came along later. But I've talked to various people who've seen the actual FDA submissions. They're of the view, although they won't be quoted on it, it was all about politics. It was all about the war on drugs. It was all about trying to stop people protesting the war in Vietnam.
Professor, do you think that if there was decriminalisation...
Could you speak it a bit louder? I'm struggling to hear you. Put it nearer your mouth.
Professor?
Yeah.
Do you think it would be an improvement if decriminalisation of drugs occurred for the treatment of major depressive disorders and
Well, I think we should
distortion?
decriminalise personal possession of all drugs. But in fact, you've done that, haven't you? Scotland's done that, at least for first offenders.
We
That's
have
what
not.
your
We have done the
Chancellor
absolute
did
opposite. We've criminalised
12 months
it to
ago.
the max.
And I think we should decriminalise personal possession of all drugs because criminalising people for drug use does nothing but make them more criminal. And I absolutely think we should make them available. We don't have to decriminalise them. all we have to do is reschedule them from Schedule 1 to Schedule 2, exactly as what happened in 2018 when the Chief Medical Officer, Sally Davis, rescheduled cannabis from Schedule 1 to Schedule 2, and that allowed people whose children were dying of epilepsy to get treatment. So all we need to do, the Chief Medical Officer, Chris Whitty, needs to say, yes, they're medicines, obviously they're medicines, otherwise Australia wouldn't have made them a medicine. They're actually kind of rather similar people to us Australians, a bit richer, but apart from that. And yes, that's all he needs to do. But he isn't going to do it because we are run currently, well, us in England are run by a department called the Home Office, which is run by people who have a zero interest in rationality and who see drugs as just another thing to beat up non-voters with.
Another question over here?
Yeah, go do it. Although, I have to say, I've had a number of unsuccessful dialogues with the SNP about being more rational about cannabis.
There's a question over here, see?
Fire away.
Fire away.
You mentioned that you can, to a certain level, predict how a person's brain activity will change after they've taken a psychedelic drug. How accurate are those predictions, and could they be used to assess whether or not a patient would benefit from a psychedelic, or whether they'd be the type of experience of benefit?
Well, yes, great question. So, there are correlations. The R is about 0.5. So if you understand that, you tell you it's not that predictive in an individual, but it's helpful as a population. So we're trying to improve on that. To answer your second part, is there anything we can measure beforehand that might predict? And the answer is no. But again, it's early days. And one of the things we need to do, and we are doing this, is we've got an international consortium of brain scanning people, fMRI particularly, and we're all trying to put all our data into the same data set with the same way of visualizing and analyzing the data. Then we'll have several hundred data sets for depressed people, and that might then begin to point towards particular circuits which predict better outcomes. The other thing we're trying to do is one of the big problems we have is we cannot determine exactly what the trip scale will be. We give everyone the same dose, but we cannot guarantee that they will get the same effect. And we know more effect is better outcome. Now, that's impossible to regulate when you're taking something orally. But one of the things we've been doing is using an intravenous infusion of DMT, which is the active ingredient in ayahuasca. And there you can kind of titrate up the dose till people get to a state which we think might be at least close to the ideal state for the change.
Can I ask a follow-up question, which should hopefully wait for answer? So there's a thing called the Glasgow Coma Scale, which is a way of measuring that is like how unconscious a person is, and with standardized measurements. Should there be a psychedelic trip scale? Is that something that would be worthwhile to develop?
Oh yeah, we do have those.
Already exist?
We do have those, yes. It's 240 points on it. I mean, we have a very small. We use a sim. People get bored to death by doing it. Yeah, but we end up with about a 12-point scale. Yeah, we can measure, but that's given afterwards. It's actually very difficult to get people to do scales during the trip. And I'll just give you a funny anecdote. So during the LSD, we did the first ever brain imaging study on LSD, and I vividly remember, in those days, that was about 2014. We were going along the old route. Well, you give a drug and you ask people to do tasks, and you see how the drug impairs the bit of the brain that does the tasks. Traditional psychopharmacology. And one of the tasks was, can you count down in sevens from 100? So say it's like, it's 65 minutes. Jim, could you count down in sevens from 100? And Jim said, would you just piss off? I'm talking to God. So we stopped doing those things because it just gets in the way.
I think we've got time for one more question before the bar break. So
okay.
There's 3 questions there. So don't worry, you get to ask your question at the end. Who put the hand up first? Gentleman in the glasses.
He gets the question because he's bought a book already. Yeah, after the break, you only get a question if you hold the book up.
It's kind of a political question. Most people under 60 either use drugs, or their friends have used drugs, or they've suffered from depression.
Yeah.
Friends and family suffer from depression. But yeah, very few people have heard you speak to those points regarding LSD research treatment or use of psychedelics. Yet, most people under 60 are ready for that conversation, open to that door being opened. Even in a national UK or even Wales, like Scotland conversation. Yeah, last week I read that the Home Office in England and Wales at least are planning on restricting drug testing toleration music festivals. So politically, the UK, these islands are ready for that conversation, yet you have a Home Office which is, we spoke about a few minutes ago, is just going backwards.
Yeah. Well,
Could you summarise the question?
So the question is, why is the Home Office going backwards? So it was a really important point. I've been talking about the Home Office not wanting to reschedule. I'll tell you a bit about that in a minute. But the other point that was being made was that the Home Office are now stopping people doing drug testing at festivals. They won't give them a licence because, the way it's going is that I think just before next year's election, there's going to be a recommendation that we chop the hands off of people who thieve. We're going down that direction. I think Saudi seems to be our ambition is to be a kind of like Saudi Arabia. We have a Home Secretary who is truly bonkers. She wanted cannabis to be a Class A drug so that people would stop using it. What? There was an amazing debate in Parliament, the UK Parliament, about 6 weeks ago, all-party debates on changing the drug laws and changing the scheduling. What I said, rescheduling psilocybin and MDMA, just for research. So, and the speeches were amazingly moving. And what happened? The Home Office didn't even send the drugs minister; they sent the Minister for Immigration, which I think tells you where their interests are. And then we asked the Home Office, what is your objection to rescheduling? And the Home Office reply was that, well, it's not a priority at present, even though, as I just explained to you, 10 to 20 people a day are committing suicide. What is your priority? Their priority at present is to reclassify monkey dust to Class A because they think that's going to get them a few more votes, get the Daily Mail on board. The comment was made about decriminalisation. We have drugs policy in this country is run by people who think like policemen and who want to do nothing more than use the criminal sanctions in order to achieve votes. They know it's not going to work. They know perfectly well. I just should have said, I didn't finish the comments I made about John Ehrlichman and Nixon. So after the election, Ehrlichman was asked, and he said, yeah, we were running into trouble over Vietnam. We had to distract the people. So, we decided to attack black people for using heroin and hippies for using psychedelics and cannabis. And afterwards he said, did we know we were lying about the drugs? Of course we did. Of course we did. We all know that politicians lie about drugs, actually except for the Lib Dems and the Greens. We know that. They know that. But no one calls them out. And when I did, I got sacked. And maybe that's the time to break for...
That's a very good time to stop for a bar break. So we're going to stop for about 10 minutes. So just refresh your glasses, think of new questions, and then we'll
cool.
Get back together in about 10
minutes. And if you want
minutes.
a book, I'm going to come and sign some now. Thank you. Grand. Thank you.
There you go. There's your drug.
Here's me drug, as you say.
Right. Terry, and then this gentleman here.
Right, we've talked so far about preparing people.
Yep.
Do they become more creative? I find my best ideas occur to me when I'm just about waking up or half asleep.
Yes.
Is that anything to do with it?
Well, it's interesting, and it is similar, and I do mention it in the book, but I should say that there is an audio book, if you can. I don't have a Braille book, but there's an audio book you can listen to.
I'm raising audio domain.
And yes, of course, that's this thing about... We've got a chemist. Where's our chemistry teacher? Where's she gone? Here she is. Kekule, discovering how the benzene was a circular molecule. Yeah, so that occurred to him as he's dropping off to sleep. So it's quite common for people to have brilliant insights as they're falling off to sleep, and then you wake up and you can't remember what they were, which is really irritating. So it's best to write them down before you go to sleep. I think they're similar in the sense that you are switching off the control centers of your brain and allowing your brain to work more freely. So I think in that sense, psychedelics are somewhat similar. And it emphasizes the point I was making earlier, that your brain is an amazingly efficient tool for doing what it's always done. But it's kind of lazy, and it doesn't like to be challenged, and it just likes to carry on doing things because that's the most energy efficient way. And one of the most remarkable examples that's come out of our research with psychedelics is colour vision. And we noticed after the first couple of years, we had most of our studies were on men, we noticed, and they're more likely to have colour blindness. And we noticed a couple of them said, it's very weird, I can see colours better after you've given me this trip. And then one day I got written to by someone just out of the blue. I get a lot of emails just from people. And he said, I've got this quite rare kind of colour blindness. My brother is a complete, fine art fanatic, and I could never understand it. And he said, one day he gave me some mushrooms, and I took some mushrooms, and I went to see this picture, which up till then I'd only ever seen as a mass of muddy brown, and it was a famous Monet, the picture of Santa Maggiore at sunset. And he said, for the first time, I understood the nature of art. And he said, I just was in tears for an hour watching it. And I thought, well, that sounds to me quite important. So then I managed to persuade a mate of mine is called Adam Winstock. He runs a global drug survey. So I persuaded him to put into the next global drug survey, about 2018, questions for colourblind people. Are you colourblind? Yes or no? Have you taken psychedelics? Yes or no? Do they affect your colour? And what comments would you make? And we got about 50 replies, and about half of them said categorically that their colour vision was improved by taking psychedelics. And for some it lasted a very long time, for some it just lasted during the trip. So we published this, there's a paper out there, Psychedelics and Colour Vision. And of course the physiologist said, well, it's impossible because colour perception lies in the cones of the retina. And I said, well, whether you think that, you can think that if you like, but the fact is, there's more to it than that. And we don't understand it fully, but the reason I'm rambling on about this was to pick up the point I made at the beginning about the laziness of the brain. For most of us, unless we're artists, colour doesn't really matter. I mean, especially if you're a man, you don't even know what colours you're wearing, do you? I mean, I haven't a clue now. I mean, I don't, you just, and I think our brain suppresses our interest in colour because it's kind of inconsequential. We as a species are absolutely obsessed with language, and we downplay colour. And I think, in fact, one of the things we know that most of what your brain is doing is actually suppressing your brain doing things, and it suppresses a lot of vision. It suppresses colour. I think psychedelics just stop that suppression. You cannot suppress during a trip. Wow! So you get your colour vision back, and I think that's definitely.
There's a question here. Then I'll come.
Can I just say a bit more? Can I just go on about this? So
okay.
There is, if you don't mind, I'm in a bit of a roll here.
I was going to ask about hearing.
Yeah, well, interesting. So hearing isn't. We understand less about hearing. People do get synesthesia, so the sounds have colours under psychedelics. Yeah. But there's a paper coming out. It's going to be free. There's a book. A free book is going to be published on a big psychedelic conference, a mushroom conference that happened last summer, and it'll go out. If you follow me on Twitter, I'll tell you when it's live, and it's free. And I've written a chapter in that book about the contribution of William Blake our understanding of psychedelics. So you're probably all aware of who Blake was. You've probably seen his amazing sort of lithographs, and he wrote the song. Well, he wrote the book Jerusalem, which was turned into the song by Hewitt Parry. And maybe you don't all know this, but Aldous Huxley's book about his mescaline experience, The Doors of Perception, that is taken from a quote by William Blake, because Blake was a visionary artist, and he said, if the doors of perception were cleansed, everything would appear to man as it is, infinite. For man has closed himself up, so he sees all things through the narrow chinks of his cavern. Actually, what's staggering about that is exactly how the brain works. I mean, Blake was, he wrote this 300 years ago. We now know that's how the brain works. So I've written this big essay on what else is called Behind the Doors of Perception. What else can Blake tell us? And Blake was a total genius. So there was a very interesting tension historically between Newton, who you all know as the great physicist who worked out that light was made up of different frequencies. Well, he didn't know it was frequencies, but of different things. It's called different colours. Newton, he wrote Principia Optica about his research on light. And he did that in about the 1650s. And then 100 years later, Blake wrote his work on vision. And he said Newton is just so trivial. What Newton does is just the bare optics. But Blake believes there are 4 levels of vision. There's the Newtonian vision, which is what colours are there. And then there's a way you interpret it. And then there's the third thing is essentially, how you weave it into your life and your planning and your meaning. And then the fourth one is the spiritual value of vision. And I think that's actually exactly what psychedelics do. Psychedelics take vision from optics to something much more meaningful.
You said about small companies not being able to develop some of the drugs because of the cost of research. In some cases, like MDMA, the research has been done, and the manufacturing methods are known. Couldn't it be licensed? And could be, secondly, that's two-part, more small-scale, local, grassroots production?
Yeah.
Psilocybin, it's already happening with the mushrooms.
It's a really good point. It's a super point you make. And in fact,
did everybody hear that at the back?
So the question is, why can't, given that MDMA is relatively cheap to make, I mean, nothing's cheap to make to GMP standards, but it's relatively, we know how to make it, and it wouldn't be difficult to make, and we can grow mushrooms anywhere. So why not have local production? And actually, that is, I suspect, where it's going to go. And it's already happened. Oregon, in the election that brought in Biden, Oregon voted to make a statewide provision of mushroom centres for well-being. And it was most of Oregon is going down that road. You can opt out, so local townships can opt out, but most are opting in, and Oregon is now having a license system to make mushrooms available for therapy. And that's remarkable for 2 reasons. The first is that is still completely illegal under federal law, but they're not going to enforce it. And there's an important message there. Because in Britain, people like Braverman will say, to do that would be to break the UN conventions, which it would be. But America's quite happy to do it, and they made the UN Convention, so why can't we? We just fall behind this bureaucracy to justify doing nothing. But the second thing is, it's almost like it's kind of socialised medicine in America for the first time. A state making available something kind of for free, amazing. So that's going to be quite transformational. And Colorado is going to do it, going down the same routes later this year. Almost certainly California will do the same. So quite a lot of the more liberal states will do that. Canada's likely to do it. So that may well be the solution to the problem of not having pharma companies developing it. But the reality is, as I said, in order to to take a drug through the current marketing registration model costs hundreds of millions of pounds because the burdens are so high. And I say, and that's one of the reasons Australia changed their law, because the evidential base that we've got going from the 50s and 60s with psychedelics, we've got there's published data on 40,000 patients until 1967. There's published data now on another 1,000 patients in the modern era. No drug has ever gone on the market with that many patients. So the evidence base of safety is overwhelming. And the Australians say, well, why should we wait for an American company to condescend to come and sell to us? Let's just get on with it.
There's a question here.
Two things really. One is how can we persuade the British psyche that these drugs aren't frightening, terrifying, and should be kept away from? That's number one. Number two is, if this is an effective drug, what will be the tipping point of getting everyone in psychiatry and mental health to use it? Because presumably therapists would have to be retrained.
Yeah.
To do. If you talk about these
Well,
sessions.
I would say several things. Yeah, that's two very good questions. So the first thing is, I mean, the way we change the public's mind is to get them to read the book, or read Huxley. I don't mind. You can read either. He's more articulate, but this is more up to date.
But not the Daily Mail then.
Well, there was one good article in the Daily Mail 2 weeks ago on the Mail at Weekend about this, actually. That's unusual, 1 out of 100. But anyway, it's a start. What do we do in therapy? I mean, we have a psychiatrist here, a practicing psychiatrist here, and a psychiatric pharmacist here. We can ask them in a minute. I don't think this is magic. What we do in psychiatry, doing therapy, is very challenging and difficult. I think the skills we have are very easy to use in psychedelic therapy. Let's be clear about this. The first study we did in 2012, no one had done psychedelic therapy for depression. We kind of managed. We worked it out as we went along. It isn't rocket science. Some of the stuff, people say, oh, it's so terrifying, it's terrifying. When you use MDMA to treat PTSD, you're getting people to relive the trauma. That's what psychologists do every day of the week. They relive the trauma. The difference is they do it to people who can't really sustain it and often have breakdowns. Under MDMA, the traumas, they can cope with the trauma. So it's actually safer than the therapy we're doing at present. So I think the problem is going to be is in getting psychiatrists interested. Yeah. But I think they will. I think younger psychiatrists, as the examples in the audience here, they will. They're seeing this as actually making psychiatry interesting again, rather than simply writing prescriptions for SSRIs. Yes.
There's a question over here.
I'm a psychiatrist as well, actually.
So you're what?
I'm a psychiatrist as well.
Cool. You're young as well.
Not that young.
Everyone's younger than me.
Yeah, I mean, I'm a massive proponent of psychedelics, but I think that in our answer to that question is that my understanding is they're contraindicated in many conditions we see, and personality disorders, bipolar, schizophrenia, and I think you don't think so.
Well, let me put it this way.
Contraindicated and then there's
Yeah, I mean, the point is the number of people with PTSD is 7-8 times the number of people with schizophrenia. Okay? So there's an awful lot of people. So yeah, we do. We recommend don't give them to people who have got schizophrenia. We recommend don't give them to people who've got bipolar type 1, manic bipolar. Beyond that, we don't know whether there's any real risk at all. So I think the vast majority of people in psychiatry would benefit. And what we're saying at present is, well, use it in the third of those who don't respond to current treatments. But that's still many millions of people, and those people are the people who are suffering most, as you know.
There's another question from this lady here.
Yes, I was wondering if you had found that there was an individual with intractable disease, why is there no more push forward in the use of psychedelics in microdosing?
Well, the point is that the law makes it impossible to do microdosing research in this country. 6 years ago, we had ethical permission to do a microdosing study with LSD. But the ethics committee said every dose had to be given in hospital, And they had to stay there for 12 hours till the LSD cleared. And we said, it's a microdose. And they said, yes, but it's LSD, and you've got to stay in hospital for 12 hours. And my hospital was charging £1,000 per person per day. And if you imagine, if you're going to treat someone for 6 weeks, it was impossible. So the law makes it impossible because the law doesn't discriminate between a microdose. In fact, a single molecule of LSD is as illegal as a kilo. So we need to change the law to allow this research to happen.
Change the law, and that is what I'm definitely advocating for.
Well,
however, at the moment, all it is lip service, because we can't change the law unless we've got more.
well, I'm saying, why doesn't Scotland change the law? I mean, I'd vote for that. Why don't you just do it? I mean, you did it with the decriminalisation of personal possession of drugs. Why not get your health secretary to say we want to do it in Scotland? I mean, at the very least, that would start a sensible debate. I mean, as I said before, I don't know if some of you may have heard me say this when I was in Scotland trying to get medical cannabis here before it came into Britain. Whatever you do, I can guarantee we will not send tanks in.
Are there any other questions? Could I ask a quick question? Am I allowed to? I've spent the last sort of 20 years looking at sex differences in a cardiorespiratory disease, and in one of these diseases, the serotonin system is ramped up higher than in females and males.
Yeah.
Is there a sex difference in the treatment of these psychiatric disorders with these psychedelics at all?
Doesn't seem to be, no. Both women and men seem to do perfectly. Women and men seem to do equally well. No, there's no.
Oh, okay.
And also the doses seem to be the same. We don't have to adjust the dose.
Right, thank you. Yeah.
So my question is, it seems that psychedelics and MDMA have the ability to change people's core beliefs. I'm wondering if you could speak about the science behind that and why that seems to happen.
Yeah, well, it
Could
changes.
you repeat that question,
So
David?
the question is, what is the science? What's the neuroscience of changing beliefs? And it really just it's kind of what I was saying before, that beliefs are things which get set in. They start at an early age. They're inculcated by your parents, by your teachers, by your peers, and very often people go through life with never even ever bothering or even knowing that they've got them. They're just sort of there. It's sort of ingrained behaviour. It's like creosote into a sort of a shed of a garden shed. And then under psychedelics, people actually say, "Oh my God, did I really think that? Wow!" Because and they actually think differently. It allows them to recalibrate what they've been thinking before. Now, where that happens in the brain is not known. I mean, it's got something to do with circuits which relate to attitudes, which will be circuits relating to salience and probably the self circuit as well. So it's some interaction of those two. But we do know through brain imaging studies that network connectivity is increased during and after a trip, and that connectivity just allows you to think differently, if you want to. I'm not sure, not everyone does, but I think for most people, there is some benefit.
There was another question over here.
Mm.
Yep.
Two-part. SSRIs, sexually inducing drugs, people that are given them or sort of parked on them, there are patients that are given them. Some just be left on them for a lifetime, which is probably good for the pharmaceutical company, but as far as the psychedelics are concerned, is it just one hit to get them to where they need to be, and then you have to repeat that every so often to keep them where they're at? And the second part would be, is there any adverse indirect effect if someone, I don't know, like you used the example earlier where someone spoke about abuse, and that was the nature of his depression. But if that opens up a memory that they had blocked and it brings it back to life, is there the possibility that they end up in the worst place than they were before? Or does the psychedelic drug allow them to cope better?
Okay, so two really important questions. SSRIs are an interesting challenge because there are undoubtedly, and those of us who've worked in this field for a long time know that there are people whose depression comes back so frequently that SSRIs are protective, in the same way as anti-epilepsy drugs can stop people having seizures. There's no question about that at all. The interesting question is whether psychedelics could do better than SSRIs. Now, in our hands, in the one study we did over 6 weeks, that was true. Psilocybin did better. when we look out to a year, there wasn't much difference, interestingly. But certainly in the first 6 months it did better. The second question, the second part of that first question, what we haven't done and what we didn't do in that study was give people another dose later in the year if their depression crept back. That's one approach. Another approach is to say, okay, well, now you've got better on the after the psychedelic, why don't we find new ways of keeping you well? And that could be psychotherapy. Psychotherapy for most people hadn't worked. Often if people are too depressed, it doesn't work. But it may be after a psychedelic, it will work. It might be that other ways of stabilizing mood, like lamotrigine or lithium or even SSRIs might work. Or even microdosing, mushrooms. I mean, there's also many ways in which we could think about keeping people well after they got better. And I think we should try all of them. But I think at the very least we should have the option of redosing. In fact, some of our patients, because they couldn't get redosed in Britain, they would go to the Netherlands and get dosed. And then the question about what about bringing up bad memories and can you deal with bad memories? And that's a really critically important question, which is why we believe that if you're using it therapeutically, you should have supports. Our experience is that the vast majority of people, even though they find the memories traumatic and disturbing, they're much better able to cope with them. So, because they can deal with them. Up till that psychedelic, they're just repressing them. And repressing a memory involves an enormous amount of mental effort. You may not know you're doing it, but your brain is doing it. We can image the brains of depressed people. A great deal more of their brain is engaged in this internal processing, which we think is suppressing those memories, stopping them coming to the surface. In fact, we're seeing this now as people get older, as people just begin to get into early dementia. We were just a few years ago, we were seeing World War II veterans reliving the traumas that they'd suppressed for 50 years. They just couldn't have enough brain capacity to keep them suppressed. So complete suppression can work, but it's energy expensive on the brain. Bringing it back and dealing with it is likely to be better for your mood and better for your the resources, your brain resources. But it is conceivable that for some people, if we cannot deal with it, then they could be worse off, and we have to tell them that. But we haven't met examples of that, and that's really reassuring because I can tell you, conventional psychological therapy for trauma, that is quite common. It's not talked about, but it's actually quite common. That people go into therapy, the trauma comes back, and then you cannot deal with it, and so you're worse.
There was a question over here.
You mentioned the guy that earlier, AA, being a fan of psychedelics.
Who, sorry?
The guy that found alcoholics.
Oh yeah, so Bill Wilson was absolutely.
Could you repeat
definite.
the question? Sorry, can't hear it up here.
I know people who've been in AA and NA, alcoholics anonymous. Would there be a risk of someone who's AA moving on to taking psychedelics, ending up in Narcotics Anonymous?
So the question is, what's the risk of psychedelics being used, say, for alcoholism, leading to people getting addicted to other drugs like psychedelics or other narcotics? And the answer is extremely low. For these reasons, that psychedelics are not addictive. Psychedelics are unaddictive. How do we know that? Well, about the only useful piece of research that the US military did on LSD, they did massive amount of very unethical stuff trying to brainwash people, but they were terrified in the late 50s that the Russians were going to spray LSD all over America and then invade while everyone was having a trip. That's true. It's completely surreal, isn't it? Anyway, so they said, how can we protect people against Russian LSD? So they did experiments to see what happens if soldiers took a lot of LSD. And they discovered by the third day of giving them LSD, the LSD didn't work. So they had this plan, basically, if the Russians invade, everyone's tripping for 2 days, and then the third day they're ready for the Russians. So that tolerance, which is insurmountable, and therefore different from, say, opiate tolerance, which you can surmount by taking more, means that these drugs are not addictive and they're anti-addictive. Now, the biggest sadness about Bill Wilson and Alcoholics Anonymous is that in 1967, when they began to ban psychedelics, he was confronted with this terrible problem. So Alcoholics Anonymous has to decide whether it goes with Bill, who believes in psychedelics, or with Johnson, who was the president then, who doesn't believe in psychedelics. And there was a schism. And of course, the anti-drug branch of Alcoholics Anonymous became the dominant one. The psychedelic branch went underground, and has been underground pretty much ever since. It's coming back now. And millions of people, as I said early on, millions of people have been denied access to a treatment which cured their founder, which is peculiarly perverse, isn't it?
We have time for one more question. Who would like to ask the last question? No more questions?
You had a question?
Oh,
Yeah, she had
one more.
Can't we achieve the same results by meditating?
Ah,
The concept of mindfulness.
that is a wonderful question.
Could you repeat
The
it?
question is, can we not get to the psychedelic state through meditation and mindfulness? And the answer is yes. But let me tell you the story about that. So we published the first imaging paper on psychedelics in the brain in 2012 in an American journal called Proceedings of the National Academy of Sciences. We really wanted to put it out there in America because they're the buggers that block these drugs. And 3 days later, I got an email from a guy called Judd Brewer from Yale. And he said, "David, why haven't you cited our work on transcendental meditation?" And I said, "Well, because I have no idea. Why would I be interested?" He said, look, you get exactly the same brain scan changes in transcendental meditation as you do under psilocybin. And he was right, you do. And then we started thinking about it, and we realized that it took his meditators about 15 years to get to that level, and we could get it in about 15 minutes with psilocybin. So, this is a quick way to... But actually, it's turned into something kind of more interesting, in that the Johns Hopkins group did a very nice study where they got people who were trying to get good at meditating. They gave them lowish doses of psilocybin to facilitate them, to help them get into that state. And I have no doubt if you can transcend in meditation, it's going to definitely be good for your mental state. It's just that it's very tedious, very difficult, and most of us can't do it.
On that note, then, I think I'd like to personally thank David for a wonderfully engaging evening, and I'm sure you'd like to show your appreciation.